Well, thank you everybody so much for joining us. I'm really excited to be here and talk just a little bit about what I do in practice. I think what I do is somewhat unique in the naturopathic profession. There's not a whole lot of us doing regenerative medicine, and I'm trying very hard to change that. I think as a profession, this is specifically our niche. I think that regenerative medicine in and of itself is harnessing the person's unique ability to heal. And so I'm really excited to be here and talk to you guys about this. I'm just going to go a little bit through my history, and Dr. Yanis, please chime in and if there's anything you want me to clarify on. So my start was a little bit jumbled. I joke, my parents moved me a lot, and so I joke that I have never gone to school at any particular school for more than a few years, and it's somewhat true. I actually started at Portland State University here in Portland, Oregon. I jumped to the University of Oregon a couple years in because they had a really excellent biology program, and so I wanted to be a part of that. I ended up at the very end changing to general science because that was the pre-med route, so a little bit jumbled there, but really solid science background, I have to say. I've been in the sciences and been a scientist since as long as I can remember. I think that helps when you're considering going to any kind of medical program because it does help you speak the language, although it's not entirely necessary. I think that gave me a bit of a head start. Right out of school, I actually went to work for Dr. Rick Marinelli, who was a really well-known naturopath in our tribe. He brought regenerative medicine to the naturopathic profession some 30 years ago, and he passed away in 2013 from cancer. He was one of my best friends, and I'll get to him in a second, but I worked for him for several years and then ended up going to chiropractic college because I had been a patient of chiropractics my entire life. Really sick little kid and really loved my chiropractors. They were the only holistic doctors I knew of until I met Dr. Marinelli. I didn't even know naturopaths existed until right after college. So went to Western States Chiropractic College here in Portland. Much to Rick's dismay, he really wanted me to become a naturopath. And a few years into that program, I actually jumped ship and went to NCNM at the time. It was the National College of, it was still called the National College of Naturopathic Medicine. It hadn't even changed to natural medicine yet. And then at some crazy point, I started doing them concurrently, which was unheard of at the time. And I have to say it was a little bit insane, and I would not suggest anyone do that. But I did both because I specifically knew what I wanted to do, and that was to be really, really good at sports medicine and regenerative medicine. So I graduated from what is now NUNM, and I still have some NCNM mugs and hoodies that I intend to hold on to. Extracurriculars at that time, probably not much. I was a single mom. I had a little girl. When I started school, my daughter was 2.5, I think, and she is now 17.5. And so I had a little toddler, and I was a single mom, and I was doing it all, and it was pretty brutal. So I can't say that I had a well-balanced life at the time. I was just sort of in the thick of it. I was in the trenches. So the question is, why naturopathic medicine? Why does anybody want to get involved in this? So I applied for a job with another local doc here in town, another big naturopath in our community, and he actually declined hiring me because my whole background in undergrad was up at Oregon Health Sciences University in the Dementia and Alzheimer's Clinic. My whole background was in allopathic medicine. I had been a patient of chiropractic, had not a clue what naturopathic medicine was at the time. It was the late 90s, and had a strong background, was going to become an MD. I was set on it. I didn't really know there was another option. So I knew since I was a sick little kid, I knew since I was probably 5 that I was going to be a doctor. And anyway, get declined for this position as a receptionist in town. And I get a phone call a few weeks later, and I hear this golden voice on the other end, and it's Dr. Rick Marinelli. And he said, "Hi, I heard you were looking for a job, and I have a receptionist position that just opened. Would you like to meet me?" And I came down and met him, and he was probably the age I am now, which is, early 40s. And we just clicked. It was instant. And he really took me under his wing, and I spent nearly 20 years following him around and helping him out here and there, working on and off as his office manager, as his assistant. I can truly say that I have been in the throes of prolotherapy. I'm sorry, there's a loud, it's really hot here today in Portland. Got the windows open. Anyway, I have drank the Kool-Aid. I just absolutely was floored by the work he was doing. People would come in wheelchairs, and within a few weeks, they would be leaving. It was a cash practice. Insurance didn't cover naturopaths at that time. they would walk out signing their own checks, standing up, walking. It was amazing. And he had these 4-inch needles, and I didn't know what he was doing back there. So I learned, and it was prolotherapy. That was mainly what he was doing, and acupuncture as well. He was kind of a Jedi. I was a really sick little child, and so this was very intriguing to me because I didn't realize there was another way, and I didn't realize that you could really harness the innate ability of the body to heal. It had never been presented to me. All that had been presented to me was pills and more pills and more pills, and I had taken a slew of pharmaceuticals my entire life. In and out of hospitals, in and out of doctors' offices, in and out of specialist offices, and really my chiropractors were the ones who maybe handed me a bottle of supplements or suggested I might want to, alter my diet or increase my protein to induce healing, or check my sleep, or check my stress levels, or be sure to exercise. And so they were the ones I really trusted growing up. I can tell you I have seen, maybe not an oncologist, but I have seen almost every kind of specialist there is, and generally would get scooted in and out of their practice, in and out of the treatment room. When I was working at OHSU in the late 90s, I was told in 1997 by the head neurologist up there that if he spent more than 7 minutes in a room with a patient, he was losing money. And I immediately decided that the insurance model was something I wanted nothing to do with. So to this day, I have not taken insurance. I've been in practice almost 10 years, and I don't take insurance. I never have, and I'm fine with that. So what I really wanted to do when I jumped ship to go to NCNM from Western States was I was going to give up on chiropractics, and I was going to become a naturopath. And the reason being ultimately was I wanted to have a license to wean people off their drugs. That was important. You cannot tell them to discontinue a drug unless you have a license to prescribe that drug. So as a chiropractor, I would know better, but I wasn't allowed to say anything. My hands were tied. The naturopathic license gave me a license to really practice the way I wanted to. And then I wanted to be able to inject people. I wanted to be able to do prolotherapy like Rick did. And although my hand skills and my biomechanical skills and my anatomy skills and all of those skills were very strong coming out of chiropractic college, I certainly couldn't put a needle in somebody with that license. So that was my driving force. And I will say that I found so much more. I found the heart to my medicine. I found the love of how to heal the body, and the vis naturae medicatrix, and just all of the things that come with that. There's a joke when you look at all the different schools that NCNM is the school with the most heart, and there really is a lot of philosophy in that school, and there's a lot of heart in all the schools. And I've taught students from all of them and been to several of them, and I love them all. They're all very unique. But NCNM really is that kind of old school naturopathy, at least from what's been shared with me. So my weekly routine, which I thought this was an interesting slide to answer. I have a whole online business that I am in the thick of getting off the ground, and that takes generally 2 to 5 years. So it's a whole different baby for me. It's very different than building a brick and mortar practice. I had great success building a brick and mortar practice, cash. I did so on a lot of elbow grease and a lot of grit and a lot of blood, sweat, and a lot of tears. But I did it, and I got that going. And I had Rick Marinelli to model. He had a cash practice that I watched for, well over a decade before I got into practice. So I knew sort of how I wanted things to go. I knew what I did not want to do based on working for him as well. Learned a lot. But for me, I feel like I want to reach the lives of millions of people, and I don't feel like I can do that by simply seeing patients all day long. That is not the best use of my time. I love clinical practice. I love seeing patients. I love helping patients, but the message I have is bigger. My battle cry is bigger, and I have decided that I can reach, with even the last few years, what the internet has brought is amazing. And this kind of technology wasn't even available when I started practice. So I really hope to reach millions of people that way. I just put a video out, a little exercise video I did in my hotel room the other day, and within 3 days, 15,000 people had viewed it. So that's the magic of the internet. Also, I want to educate physicians online, and not just naturopathic physicians, but all different kinds of health practitioners, including strength and conditioning coaches, PTs, you name it, health coaches, nutritional therapists, and hopefully their reach will be in the millions of patients. If I can inoculate them with some naturopathic mindset and tenets, and treatments, hopefully they can touch their patients' lives and it will spread that way. That's really what I see my best efforts being. So I practice clinically 1 to 2 days a week. I do I do all injection therapies, and that can be pretty high cortisol, high stress. It's awesome. It's fun. It's very technical. It's very hands-on. I hardly ever sit down, but it's a lot of energy to carry. You're dealing with people's pain, and you're actually inflicting some pain. So I have to be on my toes all day, and I like to just cram a day or two in a week where I'm packed with patients, and then I'm resting. I really do need a day off in between because I just energetically can't. I don't manage that well. And then the days I'm not seeing patients, I'm working on my online business. So people joke and say, oh, it must be so nice to only practice 1 to 2 days a week. But I earned that through a lot of years of practice. And I work my hiney off. Anyone who knows me knows I probably work 7 days a week, unfortunately. Speaking engagements have been really big for me the past couple of years. I've done a lot of online things, a lot of online summits and podcasts. But more importantly, I'm probably on an airplane at least once a month, speaking and lecturing at different conferences. Some of them are for MDs only, and I'm the only naturopath in the room. Often I'm the only naturopath on the docket for the whole weekend speaking. I'm often the only woman, to be honest, because the circle I run in is orthopedics, and orthopedics is often, it's a bit of an old boys club. So is chiropractics. You know, these are more male-dominated professions, which I love. You know, I'm a tomboy, so I've always been a total tomboy, so that's great. I don't mind it so much. I really enjoy that. I try to interject as much naturopathy into those lectures as I can and really kind of spread the word and represent, you know, I'm representing naturopathy, I'm representing chiropractics, I'm representing women. And so I try to do my best at that. And that's been really fun. A bit tiring to be on airplanes all the time. So I'm ramping that down a bit. For fun, boy, anytime I can get outside. We live in the Pacific Northwest here in Portland, and it rains all the time. Today's a gorgeous day, so I tend to just bail on some responsibility sometimes midday and just at least get an hour or two out in the sun. Really important for me and my sanity. I grew up in Southern California where I was outside all of the time, and so this has been, you know, a harder route, but I have a beautiful practice here and my family's here, so here I shall stay. But anything involving my dogs, I have several of them. I've always had several of them. I think they are the reason I got through medical school in one piece. They really kept me sane and they keep me connected. It's interesting. I think of animals as the gateway to nature, whereas a lot of people think that trees and the forest and all of that is the gateway to nature. And I'll agree with that. And putting your bare feet on the ground and earthing and like touching the dirt and the grass is really, really beneficial. And we have studies to prove that. But I think of animals as that connection that's even more potent and powerful. So I really try to keep, I'm not like the crazy lady that has a million pets, but I really do try to keep my connection to animals strong. I think that we as humans have lost that. And I think that shows in how sick we all are as a species. And so that's a story for another day. I'm big on strength training. If any of you follow me online, you know this. I love lifting weights. I came to strength training about 3 years ago, and it's completely changed my life. And I really believe strongly that it is the missing component to every treatment plan that I've ever seen that doesn't include it. I think it does a myriad of wonderful benefits. So I do that religiously 3 days a week. It is not negotiable. That time is on the schedule. I will keep that spot with my coach before I will not miss that. I will miss a doctor's appointment, but I will not miss my strength training session. So it's really important for me. It keeps me sane, it keeps me strong, and I believe to be a good physician, you have to walk the talk, but you also have to keep your body strong. This is not a joke. This is, even if you're just seated all day on your computer and you're not actually doing physical medicine like I do, you really need to stay strong because you're dealing with a lot of sickness and pain and illness coming from people, and it requires a lot of mental fortitude. And I think strength training is the quickest route to that. I love deadlifting. I feel like I have a secret deadlifting club. Anyone who deadlifts, we're in. So if you deadlift, send me an email. My commute is really short. I met a wonderful naturopath, cannot remember his name, an elder gentleman up at Bastyr, Seattle, and years ago, back when I was a student, and he said, you keep your practice and your clinic close to your house. Don't you dare spend an hour getting to and from your clinic because that will wear you out faster than anything. And physician burnout is a real issue. I have experienced it a few times myself personally, and I've seen it happen to my friends. It is a real issue. It's painful, and it's defeating. And if you have to tack on the weight of being a physician, it's sometimes a lonely path. It can be a hard path, and that's why I think you have to keep your body and your mind strong. But if you have to tack on a huge commute, that's going to kill you. And I think attaching a huge commute to schooling is also a terrible idea. Like, I like to be close. I drove for an hour each way to get to school when I was going to NCNM, and it was terrible. So I try to keep my commute very short. Don't love being in the car at all. Minding my shop. So my clinic, honestly, I try to stay away from it when I'm not needed there. I try very hard. I've learned, it took me a long time. When you're a doctor, you take everything home with you. You take all the, you know, I became a doctor because I care so deeply, and sometimes that's very hard to turn off. And so being able to just detach, I think men are actually better at it. Sorry. I think men, motorcycle and bike, I think men are better at it than women, but I try to just leave the clinic there, and home is for home and family is for family. And I try not to couple the two, although I will say that I get hit up every single day on social media, my email, my Facebook. Somebody's always asking for, like, hey, can you just chime in on this? I've got this aunt, or I've got this condition. Or, you know, when you start becoming an expert in something, everybody comes to you wanting your opinion. And so it's really difficult to not be a doctor once you are. So I try really hard just to be Tina Moore, who ultimately, you know, I just got back from the Tool concert in the Forge, and it was an epic adventure. Like, that's me. I'm just a punk rock girl. As a physician, I really love what I do, but I try to keep that somewhat separate. And then total hours per week, that is a crazy question, because I work a crazy amount of hours. And when you're just starting in practice, you've really got to put the pedal to the metal and bust your hiney. If somebody thinks school is hard, starting a practice successfully is easily 5 times harder. And that's not an overstatement. So I have tried to back off as much as possible. That's why I cram all my patients into 1 to 2 days, and then I release from that, because I really believe that you have to work smarter, not harder. And that's just something that's learned. And I'm glad to say I think I've learned it. Although when I asked my daughter, I was telling her that I was going to do this webinar, and I said, is there anything that you would chime in and say that would be a bit of advice that you've seen over the years that I've implemented? And she said, you work too hard, Mama. So so I have some cases I want to present. Really quickly, what prolotherapy is that's the base of regenerative injection therapies. And then that grows up into, maybe you've heard of PRP, platelet-rich plasma, and then the step up from that is stem cell therapy. And these treatments, it's a long story, but I will tell you they work significantly better in those who are healthy, because the whole point of all of these treatments is to harness the body's innate ability to heal, to regenerate and restore these tissues and joints and ligaments and tendons. Okay, so people have arthritis, people who have an injury, people who have, you name it. It's generally at the soft tissue point where the ligament or tendon meets bone, or within the cartilage layer. Joints are a live organ system. I think we think of them as these biomechanical structures. They are truly a living, breathing organ system, just like your heart and your liver and your kidneys. And I think that they get diabetes just like everything else. And I really do believe that arthritis is a metabolic process far more than it is a wear and tear process. So that means that you need a healthy individual. The doctors, regenerative injections are becoming all the rage. Everybody's doing PRP. It's a big thing. If you are doing these treatments on an unhealthy person, I think you are missing the boat and potentially doing something that's unethical, because we have science to show that these cells, the healing process doesn't actually work in people who are chronically ill. So you got to pick your patients, and that's not to say we can't help everybody to some degree, but starting with a good naturopathic protocol and getting a patient to a healthy state before you inject them, I think, is key. The way that these work is we are injecting, it doesn't really matter what solution I'm injecting into the patient. What I want is, I want to see a regenerative response. And so dextrose prolotherapy is just the injection of dextrose into ligaments and tendons to make them stronger, thicker, regenerate the fibroblasts, which lay down the collagen, regenerate the chondrocytes, which lay down the cartilage. And it's a beautiful treatment. It's elegant, it's inexpensive, and it's great. It really is dependent on the technician with the needle and syringe, though. So proper training is critical. Any monkey can shoot juice into a joint. The art of this is the needling, and do you hit all of the affected structures? Do you know your anatomy? Are you good at palpation? Are you good at diagnosing? That's where the magic of prolotherapy lies. I have trained hundreds of doctors, and very, very few of them have gone on to be successful prolotherapists unless they have those components intact as well. So just keep that in mind as I go through this. A step up from that is PRP. Now, the technique is exactly the same. I am doing a prolotherapy technique on everybody. I just have a different juice in my syringe. I've got a more potent, concentrated platelet concentrate solution in the syringe, and that has growth factors. Platelets have dozens of growth factors. We know very well what about 12 to 20 of them do, and what we're doing is concentrating those down and re-injecting those into the injured tissues. Same prolotherapy technique. If it were a shoulder, for instance, I would be treating all of the ligaments and tendinous attachments of the rotator cuff. I'd be going inside the joint, dozens of shots, actually. When people say, how many injections am I going to get? I say, you don't want to know. I have to see it until I get in there. The neck, for instance, is maybe a series of 40 injections. So we're treating every little ligamentous insertion and every tendinous insertion. The soft tissue where it meets bone is what counts. And then the third step up, which is probably, I do the least often because I think in a healthy individual, PRP is very potent, but stem cells, and that's where we take either bone marrow or fat. Both are rich in stem cells, and we do the same thing with them. So it's kind of seed and feed, and then you hit it with PRP. The stem cells are the seed, and the PRP is the feed. And it works really, really well, but it definitely does not work so great in somebody who is got diabetes or morbidly obese or deconditioned or very inactive. These are not great treatment options for those patients. I've just seen this from experience. So I want to share some cases with you so you can learn a little bit about how this works and how I blend naturopathy, true naturopathy, find the root cause, which is always my goal. I'm always trying to find the pain generator, and I'm always trying to find the root cause. The pain generator may not be a biomechanical structure, but if it is, I need to find it, and I need to hit it with my needle. There are doctors doing PRP who are my colleagues who will treat somebody 5 or 6 times with PRP and say, well, then we'll reevaluate. That doesn't cut it in my clinic. In my clinic, if you are not 90% better in 2 visits, I am missing the boat. I have not found the pain generator, or I am not understanding the systemic driving forces that are going on. It's my job to identify and treat the root cause, or identify and get them to someone to treat the root cause. Since I don't really do general care in my clinic anymore, I identify it and I get them in with a really good naturopath. And then when I treat the structures, they need to be ready in healing mode, and those structures need to be identified as the pain generators, or we're wasting people's money. So I've got a case here, a couple different kinds of patients I'm going to share. 62-year-old female, history of migraines following a whiplash years and years ago. My mentor had actually treated her with PRP years back when this happened. She'd recently, so she comes in and she's like, I want PRP on my neck. And I said, okay, that makes sense. I mean, these treatments aren't forever. What we do is we get people significantly better, and then sometimes they come in for a tune-up a few years later, which is totally normal, and they're never presenting back with the original amount of pain they were in. They just are starting to feel it again. And I said, okay, well, yeah, no problem. I'm happy to do that. It would make sense that after all these years, your neck's acting up again. And then it came to the surface that she had recently gone off of her thyroid prescription, her thyroid medication. And she was taking like a natural desiccated thyroid, and it was being prescribed by a really smart doctor. And she'd been on it for decades. And she had just recently gone off it. And I know, because I know what I know, and I've seen thousands of patients, that migraines are pretty intimately tied into hormones, and particularly thyroid. And so, because you get a special kind of muscle spasming with low thyroid. And I palpated her tissues, and I was like, this feels very thyroid-y, which, for lack of a better term, I said, go back on your meds and come back in a few weeks. So she comes back in a few weeks, and she's completely migraine-free because she went back on her thyroid meds. She still was feeling instability in her neck. She still wanted the PRP for insurance, so to speak, and I was happy to treat her. But we had a very different patient in front of me once those thyroid meds were back online. So just something to consider, People look at a migraine and they think, an MD will say, let's give them Imitrex and some drugs. A chiropractor will say, let's adjust them. Who knows? I know an adjustment would help her. Her whole reason for presenting to my clinic was she had been seeing a chiropractor and the adjustments were not holding. So we had to look at a little bit different place. So, are injections indicated, or do we resume the thyroid meds? I did both, and I did them in a certain sequence. Another 65-year-old female, bilateral shoulder pain, chronic shoulder pain and a hairstylist for 40 years, tipped off by like grabbing a purse in her back seat. But this is a strong woman. She's used to being up here. For 40 years, she's been cutting hair up here. So her shoulders are well developed. Not super, I shouldn't say well developed. She's used to holding herself up. Her shoulders actually had become quite deconditioned, and she was losing muscle mass because she was aging, because she's hitting her late 60s. Treated her shoulders, nothing happened with prolotherapy. Treated her shoulder again with prolotherapy, not much happened. That's not right. She should have been starting to get much better. Treated her with PRP, not much happened. So I finally put the ultrasound down on her shoulder and I said, see this? There's no deltoid there. There's no muscle there. You have nothing holding this big, huge appendage, which weighs quite a bit, up on your body. So she's got metabolic syndrome. Her insulin's very high. She's very deconditioned, but the woman is a workhorse. She will garden all day. She will take care of her family. She never stops. I mean, she works hard, but she's just, and this is a very common thing we see with women in our society, you know, they'll work themselves to the bone, but they never stop to take care of themselves. And so her shoulder started, left shoulder had frozen in the past and had come back online. That's a hormonal issue, by the way. The right shoulder started to act up and started to freeze down. So what do we do? Hormones, injections, or strength training? She had done hormones in the past, bioidenticals, with a naturopath. She did not want to do that again. The injections were not taking, and I just gave her the come to Jesus talk and said, you need to get back to the gym. So she got in with a trainer, she got moving, she got doing, you know, just little baby exercises with little baby weights. She's not hauling around the big stuff. Significant improvement. The minute she misses even a week of that, her shoulders start to act up on her again. I feel that she's lost quite a bit of weight. Her insulin sensitivity has improved, and I feel like now would be the time to try treating her again. But this is years later. She came back to me years later and she said, okay, I'm ready for more injections. 42-year-old male, left shoulder pain following trauma. This is a great story. This is actually my tattoo artist, a surfer, avid surfer, and his shoulder was messed up because he caught, I think he was pushing some kind of large bookcase into a moving truck. He was helping somebody move, or it fell back and he caught it. Anyway, he ripped his labrum and his arm was just dead. And, you know, tattoo artists are also up here all day. And he was having a rough time with it. He came in, we did a round of prolotherapy. We followed that with a round of PRP. He got incredible improvement. And then, you know, but over the years, he had kind of, we're in our 40s, and, you know, it's not uncommon to start getting a little belly. And he, you know, wasn't terribly happy, you know, really, really fit, avid surfer, but like starting to, you know, get the belly, and sitting around tattooing all day sitting around doing any job will do that to you pretty easily. So his other shoulder started to hurt him, and we talked about it, and I said, well, you know, I can do this or this. I said, but really, I think what you need to do is start lifting more weights and eating more protein, and that would be super helpful. And I saw him maybe a year later, and I said, hey, are you still interested in getting your shoulders treated? I think he was working on my arm. He was doing a piece on my arm, and he was like, and he looked great, by the way. He had lost weight, and his shoulders were now bigger than his stomach, like as far as broad, and he was looking really, really, you know, not huge or anything, not like a radical shift, but you could tell he'd been hitting the gym. And he said, actually, no, I did what you said. I increased my protein, and I started lifting more weights, and my shoulder pain is totally gone. So did I treat him? Yes, at some point I did treat him, but I think the best work I did with him was convincing him to really up his protein, which would potentiate his testosterone and his anabolic healing ability, and to get back in the gym. So a little naturopathy tied in there. 55-year-old female, lumbosacral pain, chronic, meaning those SI joints, low back. MRI, of course, showed mild disc herniation. Was there trauma? No trauma, kind of, sort of. There was a little bit of trauma, but not really. Pain up and down the spine, random joints as well. Like, this is kind of the patient I see all the time, to be honest, is like these women who come in, they're protein starved, they're pretty deconditioned, and they hurt all over, and it really is ramped up in the lumbosacral area, and nothing is helping, and there's a lot of emotion usually around this, and sometimes there's trauma and sometimes there's not, and we all have disc herniation by the time we're 55. All of us have terrible looking MRI, so that's kind of irrelevant to me. But she lays down on the table, and she literally has no glutes. Like, when someone lays down on the table, they should have a sacrum and then glute muscles like little hills, and she laid down on the table, and it was just like a cadaver. Nothing. No butt. Zero butt. And I said, girlfriend, you have no butt, and you cannot hold your spine onto your legs. and hold yourself together down there without some glutes. And glutes are, if you listen to anything I ever do online, you know I'm a huge fan of building glutes, and for not just for aesthetic reasons, for very practical reasons, which is it holds your spine together. And so she had no glutes, and I said, do you eat any protein? And she said, yeah, maybe like 3 times a week I have a chicken breast. And to some of you that may seem adequate, but for somebody who's in chronic pain, I learned a long time ago from an old-timey MD that if you ramp up a female, most women are protein starved, especially as they age. If you ramp up their protein intake, you will significantly reduce their pain. So if any of you take anything home today from this webinar, it's that more protein generally decreases people's pain. Did she need hormones? Yes. Did she need a high protein diet? Yes. Did she need to deadlift and squat? Yes. She needed all of the above. And I will tell you, I can PRP these patients all day long, and they will not get better. And they will get frustrated, and it's very painful for them because their pain is centrally sensitized and ramped up. And if they don't address these other issues, we're not going to get anywhere. So did the treatments work? A little bit. Not as much as they should have for 3 rounds, unless they do the bottom there of the slide, unless they get their hormones dialed in. Changing the diet and adding the muscle mass to their body will significantly improve their hormonal profile, and on and on. So looking forward, those are just some cases. I hope they were helpful. Looking forward, what are my plans? I really, really intend to go as big as I can and touch as million people's lives as I can. And I get emails from all over the world at this point from people just saying, thank you, thank you, thank you. I saw some interview you did on glute strength or on strength training or on whatever it was, and I got it, just significantly changed my life. I got my 80-year-old mom deadlifting, and she's so much more mobile, and blah blah blah. And that is what drives me. That I am trying to get women in particular stronger, and I'm trying to get people in general to understand that it doesn't matter what kind of physician you see and what treatments they apply to you. If you're not doing the work, none of it matters. We as an individual organism, human being, have to do the work and take care of ourselves and take care of our own health first. And so if I can provide the content and the information on how to do that, then that's my battle cry, really. Working one-on-one with patients is not the best use of my time on this, so my online business is where my main focus is going. I will obviously continue to practice. I love practicing, and I love treating, and so my practice is getting waitlisted because online a lot of people are coming, which is really awesome, and I feel a lot of gratitude and really grateful. I have to turn a lot of them away because they really don't fit at least not yet, they're not in the kind of shape that they need to be in to receive these treatments for me to feel confident in saying that they're going to work for them. So I do pre-screen patients, and I have an application process, and really just trying to bring it down to the patients that after a decade of doing this and seeing Dr. Marinelli do it for a decade before, forever. I've been seeing Prolo since I was in my early 20s. I really want to pick the patients that I know are going to respond the best and not waste. These are cash services. They're always cash services. If a doctor's billing for them, they are doing so fraudulently. So it's important that these people are good candidates before I tell them yes. I intend to keep teaching prolotherapy. That's my baby. I have Docere, which is our 3rd naturopathic tendon, I believe, doctor's teacher. And when Rick was passing the last day, he was alive. I saw him, and the day before he passed, and he squeezed my hand and said, "Don't forget Docere." And he didn't know exactly what he meant, but I think I do. So I tattooed it. And I take brigades down of naturopaths to Mexico. The other prolotherapy teaching organizations have basically barred naturopaths from coming on any of these medical brigades. And these are important learning opportunities. You could spend years in your practice trying to get prolotherapy patients and learning one by one, or you can go down to these brigades where we treat hundreds of patients safely, effectively. We help so many people for free, and makes a huge difference in the community there. And we were barred from these. And so I said I had enough of being told no, and I created my own organization. So if you're interested in that, please go onto my website, and I'll share that website with you. And I take down a group every year. We did it twice this year. It's been amazing both times, and really exciting, really incredible learning opportunity. I'm telling you, for the ability to get that kind of education in that condensed amount of time, it's very priceless. And for me, it's important that the naturopaths continue to do procedures. The functional medicine MDs are really great at marketing, and they really do have a different paradigm than we do. I know we all collectively sort of believe the same things, but how we go about treating is different. And I am a little bit concerned. I think the stronghold of the profession in naturopathy is we used to be much more physically medicine oriented. Most naturopaths back in the day were chiropractors, and most chiropractors were naturopaths. And Dr. Bastyr was a naturopath and a chiropractor, and he used to, one of his students was one of my instructors, and one of the things Dr. Bastyr would always say is, did you adjust their cervical spine? Because until you adjust their cervical spine, you don't have a clear clinical picture. And on and on. I think doing procedures, hands-on procedures, being good with your hands, I think it's really important. It's very easy to learn mind medicine, meaning medicine that you do in your head. You apply treatments that come out of your brain, but being able to work with these is priceless. And so my battle cry for the profession is really to continue to teach good quality prolotherapy the way that Rick taught it to me, and get as many naturopaths doing good quality prolotherapy as possible. That's what I want to see moving forward for the profession. That's my part in it. And really, as far as being online, also getting the word out about naturopathy. I never hesitate to share my credentials. I want people to know I'm a naturopath. I think it's important, and I think it's important that they understand what we do and the magic of our medicine, truly. And I don't mean that in a woo-woo way. I mean it in, you see studies all the time saying, oh, novel new Alzheimer's treatment, and it's like basic treatment guidelines that naturopaths do. So it's, our medicine is being swooped up in a way, but it's also being acknowledged. The microbiome being the biggest thing in the literature in the last couple of years is, oh, guess what? The gut controls everything. We've known that for decades. So it's that kind of thing that I'm trying to keep, not keep it to ourselves, but really just share that word out there. My advice for prospective students is just what I said: learn to be good with your hands and do some procedures. Rick always told me, as long as you can do procedures, you will always stay in practice. Staying in practice is not always easy, especially when there's other doctors around you doing what you do. So being unique in what you know that only you know, and doing what you do that only you do is what's going to keep people coming in the door and thinking outside of the box, and really being good with your hands, even if it's just good at laying your hands on patients too, and still confidence in them. But doing procedures is a wonderful adjunct, no matter what kind of medicine you want to do within naturopathy. Having a procedure or two that you're good at in your pocket is a wonderful way not only to generate income, but to sort of keep your mind in two places. It's really fun to do procedures, just like it's fun to craft or make crafts or do art. That's that part of that brain. And it's really fun to think about complicated cases too. So having the ability to do both, I think, is the ticket. So that's it for the lecture. You can find me. You can email the clinic at corewellnesspdx@gmail.com. That will get you through to my assistant, and she always forwards things to me that are important. My website is www.drtina.com, and on there I've got a ton of video content, podcasts. A lot of my work is on there, a lot of blog posts. Some of it's about naturopathy, some of it's about Prolo and PRP, but really it's just kind of it's where it all is right now. I've got a couple different websites coming that'll all tie together soon. You can find me on Facebook at Dr. Tina Moore. That's my professional page. I prefer if you want to follow me there, that would be great. That's where the good stuff comes out. I tend not to friend personally on my personal Facebook page as much, so I prefer to direct everybody to my professional. At Twitter and on Instagram, it's just at Dr. Tina. So, and I have my Instagrams they're all a little bit different. So I hope you'll check them out and follow me there, and hopefully I can bring some good information to your day. And if you like I also kind of have a no-nonsense way of speaking, and I really don't like doctors because I was a patient my whole life and I was not treated well. So I try to be like the anti-doctor doctor, I love all my doctor colleagues, of course. And I love my naturopaths, and I love my chiropractors, and I love my MD friends and my DO friends. But in general, I really try to keep it real and talk to people just like they're people, not that doctor-patient nonsense power play. So that's it. Do you want to chime in, Dr.
Yeah, thank you so very much. So before we get started on the questions, I just wanted to let folks know we've got a few upcoming events. So the American Association of Naturopathic Physicians is going to be in Phoenix this year, and we're going to be having a prospective student event there starting at Southwest College of Naturopathic Medicine in the morning, and then you get to go to the AANP conference for free that afternoon. The next webinar we're doing is Naturopathic Approaches to Cancer. And then in August, we have a webinar with career tips on for becoming a successful naturopathic physician. And so with that, I'm going to turn over a couple questions that we've got. Oh, there are more questions rolling in. All right. So first question, how long did it take you to set up your practice?
Set it up. Well, I had a very clear picture of what it was going to look like when I was a student. So I didn't spend a lot of time. If I was in school and I was sitting in class and I wasn't really getting what I was hoping to get out of that lecture, I would start planning my practice. I had a folder called Taking Over the World. Literally, that's what the folder, I still have it. And in there was my plan. And so I came shooting out the gates on my practice, and I had a very clear, in my mind's eye, I knew exactly what it was going to look like. And the first month I had to make rent, and the second month I made 10 times my rent. And so I started very quickly, but I also I went to a lot of conferences and seminars as a student, and I really created a buzz. I met the people. I went and met people and met the reps and that people knew my name before. And I'm not saying that in an egotistical way. I made sure that people knew who I was and what my goals were and what I did before I even got out of school. I did a lot of networking. It was a lot of time and hours. And so I came kind of shooting out the gates pretty quickly.
And I cannot, I thank you for saying that, because that is so vital. You know, a lot of times we'll hear from prospective students or current students or recent graduates, and well, how do I get started and what do I do? And I said, you've got to be thinking about that from day one,
Yeah.
from the jump. And,
yeah.
And so those are really, really important things that I listen to Dr. Tina, please. That is so important.
It is.
So the best sources, someone has a question here about how much protein, and I know there's a lot of back and forth on protein, but if there's a general place where you can send folks to figure out how much protein is appropriate for their condition.
It depends, because it depends on if they're strength training or if they're not, and what their weight is and what their metabolic profile is. So I think it would be important to get with somebody who knows what they're doing and have them give you specific advice. Whether that's a good strength and conditioning coach or a good naturopath or even a good chiropractor, somebody who can counsel based on an individual. It's different for everybody.
Yeah. Can you explain a little bit further stem cell treatment? A couple folks were asking about that.
Sure. So you have mesenchymal stem cells in your body. They're adult. They're yours. They're not embryonic. They're not somebody else's. They're yours, and they lay in your fat cells. Are actually a very rich, especially the belly fat, very rich source of mesenchymal stem cells. Also a very rich source of inflammation if you have a belly and you're not insulin sensitive. So that can be kind of a dicey game there. And then bone marrow also is a rich source of stem cells, mesenchymal stem cells, and these are cells that will turn into whatever tissue essentially they need to. So you harvest them and you process them minimally. The FDA says that we can't really tweak them much, otherwise they're considered a drug. And so they are concentrated down, usually just centrifuged to get rid of all the other stuff in there that we don't want. And it's injected back into the area, and then it takes time to heal. So, think if you cut your fingertip off, how many months would that take for that tissue to regenerate and then to have normal nervous function and normal blood flow, et cetera. So things take time to heal. But yeah, it can regenerate. It's amazing. And they are doing them in some clinics, like Harry Adelson is one of our colleagues, and he's in Park City, Utah. He's doing it intravenously. He's got a special deal, a study going with the FDA. Anyone doing these kinds of treatments, doing them intravenously in a clinic without that is breaking the law, in my opinion. So he's got he's all of his ducks are in line legally, and then he can do intravenous stem cells, et cetera, and that can have impacts on all kinds of systemic issues. I don't do that in my practice. I just stick to orthopedics, but it's pretty amazing.
So here's a question, and it's kind of interesting. And I'm no longer practicing, but you always think of the success stories. Someone's asking here about patients that you're not able to treat, and I know you talked about this a little bit, and the folks that a lot of times you'll even just turn away and say, I'm probably not the doctor for you. But can you talk a little bit about that process of like when there's someone who who isn't a success, and what do you do? I think folks oftentimes think, oh well, this is just a scam to get people paying money, and so how do you understand when things are working, who's a good candidate, and really understanding that process better?
Well, so my application process, the questions are really specific and they're based on actually a lot of just knowledge of systemic illness. And so I am looking for people who do not have a lot of systemic inflammation, because if they do, I can flare them or potentially make them worse. Here's the deal with regenerative injections, and I am sure that they're going to figure this out and in the next 3 to 5 years. It doesn't matter. I almost want to say it doesn't matter what I'm injecting in the joint. It's the body's ability to signal. It's the patient's ability to have cellular signaling that works. And a study just came out in mice showing that hair follicles would only regrow if the stem cell would only activate to regrow for the hair follicle if a certain immunologic marker called a Treg cell was present. And Treg cells are completely out of whack in autoimmune patients. They're deficient, they're out of whack. It's a very messed up, anyone who understands immunology understands the importance of Treg cells. So without properly functioning Treg cells, these stem cells won't activate. So that proved to me, I was so excited yesterday when I read that. I jumped on the bed. I was like, this proves what I've been trying to say. If you don't have a body that's ready to signal properly, that's sending the right messages, meaning the hormonal profile is somewhat sound, the gut profile is somewhat sound, they've got some muscle tissue on their body, which has also got its own whole cellular signaling system. Trying to induce healing in these patients with expensive cash treatments, I think it's not a good idea. So I send them to my naturopath friends and I have them do the work. And they may come back in 3 months, they may come back in 6 months, often they'll come back in 9 months to a year. They've overhauled their diet, they've lost the weight that's inflammatory, they've done all the things, they've done all the right things, and now they're in healing mode. It's like anyone who's had I've had a really compromised immune system, and I wouldn't heal. I'd cut myself and it would persist and persist and persist, or I'd hurt myself and it would persist and persist. That's because I was eating like crap and I was I used to chain smoke and, oh, I'm sorry about this truck. It's not too loud. This is the last one, I think. I guess we chose to do this on garbage day. I would get regenerative injection therapies from Dr. Marinelli and they just wouldn't take. So I'm looking for systemic inflammation on this questionnaire process. I'm looking for people who are motivated to get well. I'm looking for people who have some level of conditioning, because I think if you start out very deconditioned, you need to go get conditioned. Spending money on a good strength and conditioning coach would be a better use of their money than coming in and having it spent on injections that might potentially be very expensive. So I hope that makes sense and adds some clarity. I used to treat anybody who walked in my door, and I, after thousands of patients, saw some very clear paths and some very clear patterns. And it just got to a point with me where I was like, I could tell the person sitting in front of me was either going to flare or not get better with these treatments, and I could not ethically take their money anymore. I thought I was doing them a favor by trying, and after years of it, I was like, this is my battle cry, and I really think that we're going to find this out in a big way. And all the docs doing regenerative medicine on just anybody might want to relook at this and say, let's really get this person primed, get their tissues optimized, get them healthier, get their BMI down a little bit, get them into a place where they're really going to take to these treatments and it's going to set in and it's going to work. So I don't know, should I clarify on that further?
That's good. That's good. Okay. So there is a question here about cold laser therapy and any experience you have using that as an adjunctive.
Yeah, I think cold laser, I joke, I don't use cold laser because I have Prolo. I think Prolo is 100 times more potent than cold laser. It's nice. It's slow. My friends who used to use it, my chiropractor friends who were big cold laser fans and then got the ability to inject in their state and started injecting, have put the cold laser aside more. It's a wonderful treatment, but it's, 10 rounds of cold laser, 20, 30 rounds maybe is akin to like one Prolo treatment. So I just use my needles because I like them. I would joke that needles get it done faster. But I do like cold laser. I think it's a nice treatment, and it's something very safe that people can apply at home even, and every little bit helps for sure.
Thank you. So there is, and I know we had talked about this in preparing for this webinar, someone's asking for a referral in the Southern California area. Can you let us know how we can find good
Yeah.
docs?
Yeah, that actually leads me into something I wanted to close with, but I'll say it now. So if you go to my website on the homepage, there's a big box that says Dr. Tina's PRP Academy. Log into that and get access to that, because there's a 5-page PDF that answers just about every question I could think of after 10 years of being around PRP and doing a lot of it. Like, what are the main questions and answers that I run into all the time in this field? And then also there's a link to get you into a school, an online school with, there's audio, there's videos, there's all kinds of cool stuff in there and there's a link to where to find other people in your area that can do these treatments. So they may not be naturopaths, but at least you'll find a doctor that has given some training to this. So it's a really good resource. I made that resource for doctors. I made it for students. I made it for patients. I made it to basically empower everybody with as a corrective answers and honest answers as I could get out there, because I'm tired of seeing people kind of get swindled sometimes, by maybe, and not necessarily our profession, but I do see regenerative docs out there who just started doing PRP and they're like, oh yeah, this is how you do it. And in truth, they don't have a lot of experience. And so I want to empower the patients to ask the right questions.
Thank you so much.
Mm-hmm.
So we're pretty much done with the questions for today. Are there any last parting words that you want to leave folks with?
Yeah, I'll just say this really quickly. I think that my style of doing things is very different than the naturopaths I ran into before me, and I used to have a lot of hiccup about that. And in fact, I was just looking at the picture on the front of the slideshow, and that girl is not even me anymore. That girl was the safe version, and I think it really occurred to me that what I brought to naturopathy was specifically me, and I was really doing the world a disservice by not being the true, honest version of me. And so, because there's a place for all of us, if you really want to become a physician, be the kind of physician you set out to be. Write that stuff down and look at it and go back. And I wrote my mission statement down when I was a student, and I still look at it, and I still remind myself of who I was when I started, because I think that we each have a unique gift to bring to medicine, and that's really what we need to see. We don't need to see a bunch of little parrots being, we have a thing in naturopathy, like you can almost tell which school somebody came out of because of almost the way they act about the medicine. And I'd like to dispel that. I'd like us all to really, we need to get together, go to these events, go to the AANP, like see people from other schools, meet other students, and keep those communication lines going and be uniquely you. And bring to this profession what you set out to bring to medicine. So that's it.
Well, thank you so very much, Dr. Moore, for spending this morning with us. Folks who are on, I am going to stay on and answer some questions if you have any additional ones for me. As such, we will be concluding today. The recording will be up on the AANMC website, hopefully by the end of today, if technology agrees with us. So Dr. Moore, thanks so very much for spending some time with us today, and I hope that you have a great rest of your day and get out and see some sunshine in Portland.
Thank you so much. Thanks for having me. I appreciate you having me on.
Thank you very much. Have a great one. Bye.